Hello everyone, I am Dr. Sakshi, working as a geneticist and fetal medicine specialist at Motherhood Chaitanya Hospital, Sector 43 branch. So today I am going to tell you or discuss with you regarding when should you take a genetic consultation. So before going for genetic consultation, I am going to briefly discuss with you regarding the hereditary material. So our cells, they are made up of very small chromosomes, which are total 46 in number, or I would say 23 pairs. And when these chromosomes are opened, they are like thread-like structures, which is known as DNA, and has thousands of genes on it which control our functions. So genetic problems can either, broadly if I would say, they can either be caused due to some chromosomal abnormality or due to genetic or genes at the level of the genes. So a geneticist is a doctor who specifically deals with the genetic disorders. So it is very important for us to know whether a disorder is genetic or it is a non-genetic. So there are special indications when you must meet your geneticist, like if you have a family history of any genetic disorder, if there is any family history of recurrent abortions or any neonatal death, if your previous baby has some developmental delay. So there are many indications when you must contact a geneticist. For example, if you have a family history of some genetic disorder running in the family, like thalassemia, cystic fibrosis, or short stature, or if there is history of any recurrent abortions, or if your previous baby had neonatal death. Neonatal death means death in less than 1 month, or baby required ventilation, or if there was any heart disease, or if your previous baby has developmental delay, low IQ. For these indications, you must contact your geneticist before you are planning the pregnancy. Even during the pregnancy, if there is any screen positive, like if double marker is positive or triple marker is positive, or there is some abnormality detected in your scan, like cleft lip, palate, bilateral club foot, or any heart disease, if there is any stillbirth or IUD, then you must contact a geneticist. A geneticist will take a detailed family history. We may advise certain genetic tests. So what is the advantage of doing genetic tests? These genetic tests will confirm the diagnosis, they help in prognostication, and more importantly, they will predict the risk of recurrence. How much chances are there that this thing can come up in the next pregnancy, so that we can plan for the next pregnancy. Different reproductive options are discussed with you, like IVF with PGT, or even nowadays there are certain options when we can do the fetal testing when the baby is inside the womb to tell you whether that genetic condition will be going in your next pregnancy or not. So I hope you will remember these points, when to contact a geneticist, and always take an opinion before planning the next pregnancy. Thank you.